Hello everyone, my name is Jasmine, and today my blog post will be discussing psittacosis, also known as ornithosis, avian chlamydiosis, and parrot fever. So this disease system is known to impact avian species, hence the parrot fever. It tends to be a disease system that impacts the family Psittaceae, or what we notice as different sorts of tropical birds. So we're seeing parrots, cockatiels, budgies, and other birds outside of this group being heavily impacted by this disease system. Some other birds that are oftentimes impacted are going to be pigeons, birds within the poultry industry such as chickens, less commonly, but it does happen, turkeys, and ducks. We also have recently seen some upticks in research that demonstrate psittacosis's ability to have a host that may be mammalian. So we have seen this in sheep, cattle, horses, as well as swine. And psittacosis is a zoonotic disease, and we have had cases, while rare, present in humans. Moving into the presentation, the pathogen that causes psittacosis is Chlamydia psittaceae. That is a gram-negative intracellular bacteria. This bacteria is known for its ability to survive on inanimate surfaces, so oftentimes surfaces that may be associated with pet bird housing, such as food bowls, water suppliers, any sort of bedding or toys that may be within this housing area. This bacteria can sit on those surfaces and remain alive for up to 15 days, which increases the probability that this bacteria can be spread to different birds as well as to humans. The modes of transmission for this disease system are going to be direct contact and airborne. So direct contact refers to the touching of contaminated feces, plumage, or direct contact with nasal droplets or eye discharge. So this bacteria is known to house itself in the feces, feathers, or the discharge, whether that be from the nose or from the eyes of an infected bird. And this is how this bacteria can be transmitted from host to host. We also see Chlamydia psittaceae in the shedding that happens in birds as it relates to droppings and saliva, as well as mucus. Even in feather dust from the ruffling of a bird's feather, we can have this bacteria released into the atmosphere with the potential to infect another host. We also have airborne transmission for this disease, and that's going to be that inhalation of the feces or dry droplets or discharge, and usually this happens when a surface is disturbed and those particles enter the air. It makes it easier for another host, whether that be a bird or a human, to inhale this bacteria once it goes airborne. Birds are also able to ingest Chlamydia psittaceae from contaminated food, water, toys, or perches. So making sure that the different components inside of an area that a bird may be contacting are disinfected properly and cleaned is extremely important. The most common ways that humans tend to be infected from this bacteria and it's spread from birds is usually going to be inhalation of the bacteria, usually from those dry droppings or discharge or the feather dust from an infected bird. So it's really important, and we'll talk about it later in this presentation, the use of personal protective equipment when handling birds or being in a space where there's a large population of birds where some may be infected or illness may be present. First, we're going to start with the symptoms that present themselves in birds who are infected. The most common symptoms are going to be poor appetite, ruffled appearance, eye or nose discharge, green or yellow droppings, and diarrhea. So these symptoms are really good indicators, of course, that a bird is ill, but they do point specifically to psittacosis in this species. Some birds, such as chickens, may have mild or no symptoms. So chickens can actually be asymptomatic for this disease, whereas in other species, such as the parrot family and poultry, other species such as turkeys and ducks, we can see an increase of these symptoms, and they tend to be more severe. For humans, it's also something that can happen where a person can be infected by this pathogen, and when they are, those symptoms that present are usually going to be associated with other illnesses such as the flu. Those symptoms can look like sudden fever, chills, headache, discomfort, whether that be body discomfort or muscle discomfort, and a lot of muscle pain. It's also not uncommon for people infected with psittacosis to have issues with their respiratory systems, including shortness of breath and also pneumonia. Similar to birds, when they are infected, the symptoms in people could range from mild to severe. Either way, they must be diagnosed and treatment must occur. If treatment doesn't occur for this disease system in humans, the likelihood of reinfection is high, and it also can lead to long-term medical and health issues as well. Some of these problematic long-term health conditions associated with human infection could be pneumonia, endocarditis, so inflammation of the heart valves, hepatitis, inflammation of the liver, and then inflammation of the nerves or the brain, leading to neurological problems. So diagnosing and treating psittacosis in humans is extremely important, especially early on. Next, I'm going to move on to diagnosis and treatment. Diagnosing psittacosis in birds is usually going to be easier because there are specific symptoms to look for. Also, testing can occur within these flocks, and usually owners as well as managers of poultry industry facilities as well as the pet trade have information on what to look for in birds to diagnose this disease. For humans, it's a bit more complicated because the symptoms of psittacosis in humans are very closely relatable to illnesses like the flu or just pneumonia. It can be more challenging to identify, diagnose, and provide proper treatment early on. One really important question a clinician should ask any patient who is coming in with these sorts of symptoms is if they have the classic symptoms of this disease, have they had any contact with birds recently? So this could look like them being a pet owner, also them being a worker in maybe a processing plant at a farm, somewhere where they have access or interactions with birds in large quantities for extended periods of time. So that's a really important thing to take into consideration. Most commonly, the diagnosis for psittacosis in people is going to require an antibody test or the use of PCR. This testing is also similarly used in birds to be diagnosed for psittacosis. Psittacosis is a bit tricky to diagnose because it does not do well on a culture, and some other forms of diagnosis can actually increase the likelihood of this bacteria becoming airborne and infecting either clinicians or nurses or veterinarians who are trying to test for the disease. The most common treatment option for psittacosis is going to be the use of antibiotics. This is either going to be doxycycline, which is a 7 to 10 day treatment, or azithromycin, which is a 5 to 7 day treatment. Like I stated before, early detection is going to be extremely important during this time, especially in humans, and early and proactive treatment are going to help prevent the symptoms that are associated with this disease, as well as the severity of the adverse health reactions for having it a long time. The most important thing I want to talk about today, of course, is prevention. Prevention is key for psittacosis, being a zoonotic disease, and an underrated one at that. It is really imperative that there be education provided to people who may have a higher likelihood of coming into contact with an infected bird or other mammal. People are more susceptible to contracting this disease if they work in bird handling fields. Some helpful tips are making sure that someone is wearing personal protective equipment, PPE, gloves, masks, eyewear, and long sleeves when handling birds. This helps limit the ability for the airborne dust to be something that's inhaled. Also, those droplets and discharge from touching your skin directly, making it easier for you to possibly touch it and then touch your face, your eyes, nose, or your mouth. For cleaning, it's extremely important to clean and disinfect bird housing daily, removing any excessive debris, trash, feces from those housing units to help keep those birds and the people caretaking them safe. It's always recommended to spray each housing unit first. This way, when you're spraying those cages, you're coating all of this debris with some form of disinfectant. And when you let that disinfectant sit for 5 to 10 minutes, you're allowing it the time necessary for it to kill that harmful bacteria before removing it. You're also keeping it moist, which it means it's less likely to have that aerosolization and then be inhaled by someone unsuspectedly. Double bagging trash when removing it from the cages helps you make sure that you're keeping your hands clean. No bacteria from that cage is going to end up on the outside of that bag, making it easier for contact to your body. Testing new birds before introducing them into a flock is essential. This helps make sure that they have not been exposed to any illnesses, even outside of psittacosis, and it helps keep the rest of the flock healthy. This isolation can help you identify any diseases that may be present or infections that may be present in the new flock, as well as gives you time to go through your own flock, making sure that they are healthy and fine before introducing a new set of birds. For birds, it's important to make sure you maintain good nutrition, providing them the nutritional things that they need. This could include making sure that they have access to calcium and mineral-rich foods. Birds that are healthier are more likely to be resilient to psittacosis, and this helps prevent introduction of infection to these birds, as well as reinfection if they are previously infected. Providing environments that are stress-free help to boost immune systems and maintain immune systems of birds, which is extremely important if you have a large concentration of birds in any given area. Isolate new birds for 30 days minimum before introducing them to other flocks. And it's important to make sure that you can keep birds separate. If possible, making sure that birds have their own spaces helps limit the possibility of infection through sharing things such as food bowls, water bowls, perches, toys, things of that nature. And you always want to make sure that you're utilizing an avian veterinarian if you suspect illness in your bird. Making sure that you're having someone come out to test the health of your flock is extremely important, especially if you are someone who works in the farm industry, the processing plant industry, even for pet owners. Being vigilant of any symptoms or signs you may see in your bird that are different from what is normal could really help you be proactive in providing them the relief that they need from this disease. I hope that you found this presentation informational and gained something from it. And as always, have a great day and thank you for coming to the Chlam-ity Corner.